150 years ago, the German Society of Surgery was founded. Under its roof, 10 specialty societies were founded over the years. Their home, the Langeberg-Virchow-Haus here in Berlin, reminds us of the history of the society and many innovations in German surgery. Ever since, surgeons treat trauma patients and those with cancer, as well as people with degenerative diseases. We transplant organs and correct congenital malformations of all organ systems. Together with partner disciplines, we develop new concepts to prevent diseases, develop new tools for better diagnostics, therapies, and rehabilitation. Today, our trainees operate in a highly technical surrounding. In all surgical subspecialties, we use high-tech procedures, providing more gentle, more efficient, and more sustainable treatments for our patients, today and in the future.
The following 10 specialist societies are formed under the roof of the DGCH. New endovascular and hybrid operative techniques are replacing old techniques for many indications in vascular surgery. These recent innovations enable us to treat patients more safely and effectively. Cardiac surgery started its development with the repair of congenital septal defects in patients' hypothermia. Since establishing the technique of extracorporeal circulation, even very critical patients can be treated with minimal invasive methods. At a very high international level, we perform organ transplantation and provide care with artificial hearts. Highly skilled microsurgery and plastic surgery enables the transplantation of one's own body tissue. The smallest vessels and nerves are being reconnected under the microscope. The future of plastic surgery lies in the area of tissue engineering, regenerative therapies, and newly designed implants. Minimal invasive thoracic surgery and lung surgery has become the international state-of-the-art best practice. Due to this technique, our patients experience less pain. The recovery is faster, and this results in reduced length of hospital stay. Trauma surgeons treat patients following any major accidents and injuries. Modern technologies enable us, during all phases of surgery, to precisely navigate instruments and implants. This innovation leads to high precision and safety during surgery. Maxillofacial surgeons not only treat tumors in the head and neck area, but also congenital malformations and deformities. The innovation of high-tech digital techniques is an especially significant development of maxillofacial surgery. Neurosurgery treats patients using microsurgical, endoscopic, stereotactic, and interventional techniques. The specialized field of functional microsurgery helps people with movement disorders such as Parkinson's, pain, or psychological conditions. Orthopedic surgeons treat musculoskeletal conditions and their impacts on the human body. 3D printing techniques have enabled exact planning and placing of an endoprosthesis in dysplasia of the hip. This enables rapid recovery of the patient, beginning at the first post-operative day. Even complex surgeries can be performed with minimal invasive techniques. Many innovations have led to more precise diagnostics and a better quality of life for our patients. New techniques allow for safer surgeries. We provide modern training of our future surgeons and therefore ensure the highest standard of surgeons. Pediatric surgeons operate on newborns, small children, and adolescents. Congenital malformations are being corrected using minimal invasive surgical techniques, leading to precise and safe operations.
This was a compressed insight into the current and future prospects of surgery in Germany. Under the roof of the German society, we will perpetuate the legacy of our founding fathers, especially an empathic and competent care of our patients. Our society serves as a base for surgeons from many different countries and many more subspecialties than 150 years ago. This professional specialization empowers us for the future to come, the next 150 years of the German Society of Surgeons.